I'm Rick Buck and I've been a dentist for 15 years. In this video, you're about to see how and why this tooth will get a crown, including all the steps I take and why each step is important. So like and subscribe if you have teeth. 6 years ago, this patient came in and we let him know about this cavity. You can kind of see a dark shadow here under the filling on the x-ray. Then finally, the decay made its way down into this canal where the nerve lies. To save the tooth, it will need a root canal and a crown. So this here is the tooth again, and at this first appointment we are going to do a root canal. To start, we put on this rubber barrier and make an opening in the top of the tooth so that we can get into the canal of the tooth and remove the decay. This is me removing the decay. Now then we use files to remove the nerve and the infection from the canals. We fill the roots with something called gutta percha. You can see this tooth would break if you did not finish the root canal with a crown. And in fact, until the next appointment, we fill it with cotton and a temporary filling. All root canal back teeth need crowns to hold them together, otherwise they will break. And on my channel, in some of the other videos, I have examples of what happens when you don't do that. Here we are at the next appointment, usually between 2 and 14 days later. We start by removing the temporary filling from the tooth until we expose the beginning of the filled root canals. To give strength to the upper portion of this tooth, we need to anchor it to the stronger root portion of the tooth. Otherwise, the crown would likely break months down the road, like I already mentioned. So we start by giving the tooth a post. If I zoom in here, you can see on the screen the top of the root canals, and I'm going to go into the canal and remove a lot of that filled canal with this long straight drill. So with this drill, I'm creating a slot that we will fill with the post and with a resin material. Now this is probably as good as you can view it of a close-up of what that tooth looks like with the upper portion of the root canal drilled out. What we're doing here is I'm taking a fiber post that we will use to fill the roof portion of the canal, and I'm just kind of sizing it to see what size I want in the canal and upper portion of the tooth. I use fiber posts because the older metal posts commonly fracture the root over time, and these fiber posts are much more kind to the tooth. So this post fits nice now, and we're going to bond it into place. To get a strong bond, we etch the tooth surface, then we place the bond in the tooth with this brush, and we kind of scrub it into place. Then we use a light to set that bond, as well as a chemical we use to set the bond down in the canal where the light can't reach. This next material we use is called core paste. It fills up the bulk of the tooth and also bonds the post that we are going to put in now. So you see this post fits into the canal, and we use this bulk fill, which is resin that flows around the post and fills up the majority of the missing portion of the tooth. We then just used my little dental explorer to try and open any air bubbles that might have formed while we were filling it up. We do find one, and maybe you can see here where I put the explorer in, it kind of opens up one of those air bubbles. Once that air bubble is opened up, we fill that void with more of the core paste. Then we take that curing light, and this again will set the post and bulk filling into place in just a few seconds. The core paste will also just kind of set on its own if the light doesn't do all of it, but the light is good to kind of get things going because we have a lot of work to do during this appointment. Now we have a stronger upper crown portion of the tooth firmly anchored to a post to the lower root portion of the tooth. The core of the tooth is now strong, so the next step is to drill 1.5 millimeters to 2 millimeters in every direction around the circumference of the tooth. We file the tooth down because eventually the crown is going to fill in this space we are drilling out now. Now, I am not aimlessly drilling. If you drill too much tooth structure away, the crown can become loose from time to time due to the lack of retention from the walls of the stump left behind being too steep. But then again, if you drill too little of the crown away, it won't be thick enough and will likely break in time as you chew and bite on the crown. Also, when drilling for the crown, you want to make sure the stump, or preparation as we dentists call it, is as close to parallel all the way around the circumference of the tooth. Now, to be precise, you don't want it to be completely parallel, but but you want those walls of the circumference of the tooth to converge at about 10 to 5%. This will ensure a tight fit of the future crown that won't come loose, so it likely won't come off or come loose in the future as you chew and use it down the road. Now you probably all have noticed that the gums are bleeding, and that is because on this tooth we need to drill below the gum level until we reach solid tooth, and the gums get nicked and kind of beat up in the process. Now rest assured, the gums will heal back, and they'll heal back tightly around the future crown when it is done. But it's also important to go down below the gums to hide the margin where the future crown and the natural tooth meet, below the gums. If this line or this margin is above the gums, it would be noticeable when the final crown is done. If it's hidden below the gums, it's more cosmetic. In fact, you've probably noticed people with crowns and you notice that kind of dark shadow around the gums of the teeth. It's this margin that wasn't put below the gums, instead it was made above the gum level. Quickly, my favorite toothbrush, floss, and other dental products by far are in Amazon affiliate links in the description below this video. Those dental products will give you stunning results every time you clean your mouth. And you can also watch my video posted at the end of this video to see why they are the best and how to brush and floss your teeth with immaculate results. This gel here that I'm using is called Viscostat, and it helps to stop bleeding when it is scrubbed onto bleeding gums once we are done with all the drilling. Now this Viscostat tastes terrible, so we immediately wash it away. And then once the gums are done bleeding, the patient bites down to make sure we have enough space between the prep or the stump of the tooth left behind and the opposing teeth it bites up against. I also am checking right now to make sure there are no undercuts in the preparation and that the corners of all the preparation are rounded. And so as I look at this tooth, it's passed all my checks and is now ready for an impression. So that's what we're doing right here, is we're taking an impression of the tooth. I like to do this in 2 steps. First, we take an impression with a quick setting hard material called Blue Bind. Then we remove the impression when it is hard, and then second, we add a more detailed impression material layer, and we snap that back into place in the mouth. This method pushes the material below the gum level to get an extremely accurate impression of the margin below the gum level. And then eventually we take that impression out of the mouth, and if you know what you're looking at, you can see here that it has an accurate impression of the margin. Next, we take the shade of the tooth that we also took before the appointment even started. So we then take this impression and the shade and we send it to the lab. And the lab will take this and make a stone model of the teeth and take that shade, and they'll build a crown on top of this stone model. This will take the lab a few weeks, and then we'll get that crown back. In the meantime, we have to make a temporary crown so that the patient doesn't go with this stump of a tooth exposed. To do this, we use another impression we took before we drilled the tooth down as a template. When we snap this impression back into place, the material will fill the void between what the previous tooth was and the stump that is now left behind. So this temporary crown will actually be fashioned after the original tooth. Once we remove the impression, you can see there's a lot of excess temporary material that needs to be moved and trimmed away so that we can make this look like an acceptable tooth for those weeks that the patient will be waiting for their final crown. So we take a few minutes to trim it, smooth it out, and make sure it feels even when biting. Then we dry the tooth and use temporary cement to secure the temporary crown into place until the next appointment. Before we let the patient go for the day, we then remove the excess adhesive, which looks pretty good after we removed it, especially for a temporary crown here. It will get the job done until the final crown appointment. So let's now fast forward to that next appointment. So here we are at the final appointment where we will try in the final crown. So we first have to remove that temporary crown and then clean off all the temporary cement. And here we are slipping on the final crown, and we're checking for 5 criteria for an acceptable crown before we cement it permanently into place. We will also make necessary adjustments so the crown will pass all those points. First, we check how well this crown contacts with the adjacent teeth. If floss snaps nicely through the teeth, it will also likely prevent food from getting trapped between the teeth when chewing. If it's too tight, the crown won't sit all the way down, so we make sure the floss snaps nicely through. Second, we check the internal of the crown. If something is high or off internally, the crown will kind of rock, and if you don't fix it, the crown will loosen in time as you chew it, and you'll have to keep cementing the tooth on from time to time. Third, we check the margin where the tooth and crown meet. It needs to be flush and not catch my Explorer when I'm checking it. If this is open, the lab will need to remake the crown because the margin is the weak point in the crown. Once again, if it's open, it will catch food and decay will start here. Fourth, we check the bite. The bite is very commonly off and needs to be adjusted. You want to make sure this tooth feels like it bites evenly. If the bite feels like it hits the crown before the other natural teeth, then that crown tooth can become sore over time and even cause jaw problems. Fifth, we check the cosmetics. If the patient is happy with the way it looks and that the crown meets the other 4 criteria, then we're on to cementing the crown. So to cement the crown, we dry the tooth and then we put permanent cement on the interior or internal of the final crown and have the patient bite that down into place. And you will see that a bunch of excess cement gets expressed out of the crown. We remove the excess cement with an Explorer and floss and other materials. Watch my daily dental care video I have posted now for the best technique, tips, and product recommendations for a stunningly clean mouth that avoids tooth decay, gum disease, and gives you fresh breath. The best dental products that I recommend are in Amazon affiliate links in the description below. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.